And today we will be discussing the easy way to get used to your new progressive lenses or your varifocals or your new multifocals. Now, the first thing I want to say is that there's no real easy way, but we're going to give you some tips what to do to make it easier for you. And also we'll backtrack quickly just to give you a brief explanation of why do some people experience a lot of discomfort with new varifocals or new multifocal spectacles. So firstly, always remember that your multifocals gives you distortion, and it's your brain that needs to learn to see in the distortion. And let's have a look at my set of multifocals.
Now, this is my multi or varifocal, and you can see through the top, look how clear the image is. But if you look down towards the bottom, look how fuzzy it becomes, because that's the reading area. So at the top, you can see, I can see the buildings on the other side, it's pretty clear. But looking through the bottom, as I go lower, look how fuzzy it becomes. It's totally fuzzy there. And this is what I mean by these different areas in the multifocal that corresponds to your unique different areas where you want to be looking, be it distance or be it close. Reading is clear at the bottom only, so you have to be in the right area. You can see how fuzzy that gets as well. Look at all the distortions there, look at that.
Always remember that multifocals or varifocals work the best when both eyes work together. Because why is that so? Remember that when you are looking far away, your eyes are looking actually towards the horizon, and they are in a parallel position. So your eyes are both looking straight at the stars, and your multifocals assume that you have two eyes where both of them is working well, because one of the things that multifocals do is they tend to give you distortion, and we'll come back to that in a moment. But when they build this lens, they ensure that when you are looking straight, both eyes are looking straight in parallel. But when you are reading, your eyes tend to come in at an angle. So when you converge, the multifocal has actually made a channel so that when you converge at a normal angle, at a normal distance, the variables, the multifocals, your progressive lenses, they actually change and they have a corridor into which your eye actually supposed to go. Now they assume all of these things, that you have two eyes, both has got good vision. They assume that you are standing up or that you are sitting up, because only then does your normal vision system work in that particular way. You will able to get the best out of your multifocals. You would have noticed, if you are wearing multifocals for a long time, that you are unable to read in bed with them because you are not sitting up or standing up. It's only when you're sitting up and standing up that your varifocals or your multifocals work the best, and only then when you have two eyes and the left lens actually comes in at an angle and the right lens comes in at an angle. And when they manufacture these lenses in the laboratory, they clearly mark them left one or right. When they design these lenses, they have to make these assumptions that you've got a good normal vision. Now, that's not always the case, as we know that as we grow older, that's very often not the case. So the next thing is, the lenses are basically then tilted to compensate for your convergence. Now, if your convergence is poor, now for example, say you now look close, but your eyes can't converge. So this eye's sweet spot, as I call it, is right here. The other eye is there, but now you're looking up, you're looking down, you're looking up, you're looking down, but the one eye gets tired and it cannot converge. You will also have problems with getting used to your multifocals, and you might find that they are not effective at all actually for sustained reading. And for that, go and have a look at my video again about binocular vision, because you need to be able to converge if you want to use your multifocals successfully. Now, always remember that as you grow older, you also tend to have a higher prescription difference between your distance and your reading prescription in your multifocals. Now, the bigger the difference between your distance prescription and your reading prescription, the bigger the difference, the more distortion you get, unfortunately. And it's the distortion that you now have to get used to, or your brain needs to learn to work with that distortion. So you get different designs of multifocals, and I am assuming that this is now not the problem at all, and the problem is simply that you are struggling to get used to your multifocals. Now, the older you get, the smaller the visual field becomes that's clear in your multifocal. And the more accurate you have to look up and down to make sure you get that sweet spot. So many years ago, when most of us was wearing like bifocal spectacles, and now you will ask, maybe some people will ask, what's bifocal glasses? So bifocal glasses are not like multifocals. So multifocals, this is how they start their life. It's a lens like this. There's a different curve at the top and the bottom, but there's no demarcation line at all. Now, if you remember, bifocals are those lenses where you had a big fat line across the lens. Either a big fat one like that, or you had one like this. That is a bifocal lens. Now, the big difference is that with the bifocals, at least you knew precisely where to look, because you were looking through the top into the distance, and you were looking into the bottom for reading. So your brain knew that if I looked up above the line, that was distance. Below the line, I could read, but there was no intermediate area. Now, multifocals tries to give you that intermediate area. It's not always successful, but remember, with your multifocal, the top part of the lens is still distance, the bottom part is still reading, but there's nothing that tells you where it stops and it starts. And that is the biggest problem. So watch out for excessive head movement, because when you look up with your multifocals, you want to go right to the top, around about there. You want to just look underneath the top of your frame so that you know you are in the distance area. And when you now lower your gaze and you do not want to use your head, you always want to first lower your gaze. When you lower your gaze, make sure you are at the bottom. Make sure that you are in the reading area, because there's nothing that tells you you are in the right area. So I tell my patients, just sit still in a nice old kitchen chair that's straight up, and literally just look up, look into the distance, and then whilst you're looking there, make sure that you find that sweet spot where it's the clearest. Because again, when they make these lenses, they assume that you've got a certain height, that you are reading at a certain distance, and at a certain angle. But we are all different. We've got different heights, we've got different working distances, and we hold things at a different angle. But in general, if you just stand up or sit down straight and you look up, you're going to get the distance at the top of your multifocal. And when you now look down towards the bottom, hold it at a normal 40 centimeter distance, just about arm's length, and then you will be most often in the right spot already. But if it's not clear, keep looking there and just gently move the chin up and down. Don't rotate sideways. Move the chin slightly up and down until it's absolutely clear. So the trick is, if I can call it like that, is you're going to have to teach your eyes and your brain where to look in this lens for your unique requirements. Because if you are just doing this, you're creating so many angles, your brain and your eyes will never learn when to look in your lens. So that is the most important part of getting used to your multifocals, is do not move your head. Literally, keep your eyes and move the eyes down. Don't move the head, move the eyes up. Ensure that you always move your eyes first before you do any head movement. This actually eventually gets and your brain actually learns very quickly. It's like muscle memory eventually. You don't think about it, but in the beginning it's an eye exercise. I literally tell my patients they need to practice this 2 or 3 minutes a day for at least a week or two. Make sure that they learn, they teach their eyes where to look, and then they will find that things are just so much easier. And what often happens as well is that when you are now looking down towards the reading area, you find that it's only a small little spot that's clear. And why does that happen? Because most often a month down the line, you go, good heavens, the whole page is clear. So what actually happens is that as you look down initially, the eye is unstable. It's not used to all this distortion in the multifocal. It's not happy. The focusing system is bouncing a little bit around. And what actually happens, the more that your eyes are straining, the smaller this area is that becomes clear. And the quicker you teach it where to look, the more the focusing system tends to relax. Everything starts working a little better, and your field then enlarges. And you find that after 2-3 weeks normally, you find that I'm doing well with my multifocals. I don't have any problems. But always remember, watch out for doing this. Now, why do I mention this specifically? Because remember, multifocals are actually made to look through at an angle. Sounds crazy. So if you are used to reading glasses you have to literally, you got to tilt your head down so that you look straight on through the reading glass. So if this is my reading glasses here, if I want to see through these things, I need to actually tilt my head down. I need to do that because the middle point of the lens, I need to make sure that everything is level and flush. So I need to tilt my head down if I want to reading with my reading glasses. But with multifocals, it's very different. You cannot do that. So if you are switching between multifocals, varifocals, and reading glasses, you need to take the time to teach your mind that with my multifocals, I need to just move my eyes. But with my reading glasses, I need to tilt my head. Because if you do the head tilt story with your multifocals, you very often find that what happens is that in a relative position, this is at the top of your glasses, your distance, this is at the bottom. But if you're now looking down with your head, you're actually not lowering your gaze. So if you're now looking down with your head, you can see your reading, but you might find that after a couple of minutes, because you haven't initially lowered your gaze enough and to get into the right reading area, if you carry on like this, if you just move the head forward like this, you're not actually lowering your gaze to the bottom of the lens. What happens is that the eyes get tired, and then you have people like doing that. They've got to actually they haven't lowered their gaze enough in the beginning. Now their eye is still there, their head is like this. They've got to tilt their chin up to get to the bottom part of the lens where the reading area is strong enough for them to read comfortably. So be aware of that. And when I have a patient in my practice that has had quite a large change in prescription, I would always suggest that they follow a very specific routine when it comes to adapting to their new multifocals. Always sit and use your varifocals, your multifocals in your comfortable chair, watch some TV, walk around in the house, and after maybe a couple of days, go to a mall where it's level preferably, not too many stairs, not up and down, and see how you're coping with that. And then lastly, you can actually wander outside your house, in the street, maybe drive a vehicle, and it can take up to about 2 weeks for a normal person to get used to a new set of multifocals. And we always check our patients after 2 weeks. But 2 months down the line, you're not used to your multifocals, there's something the matter. I call it eyeball awareness. You should find that this goes away. And when we test our patients, we always ask them to check 2 things first. It's their clarity of vision and their comfort levels. So I want my patients to see clear and comfortable. And when we do a follow-on examination with their new multifocals after 2 or 3 weeks to see how things are going, we check 2 things as well. We check vision, which refers back to your clarity, and we check adaptation, your comfort levels. Have you adapted? How's things going? Are you feeling more comfortable with your multifocals? And this is what we do in the practice to ensure that our patients adapt comfortably to their new set of multifocals.